I am joined by two wonderful world-shaping women. Dr. Jean Chamberlain-Froese is the founding executive director of Save the Mothers. She and her family spend 8 months overseas each year in Uganda. She's based at McMaster University in Hamilton, Ontario, where she's an assistant professor, and she directs the university's International Women's Health Program. This obstetrician gynecologist has traveled to the poorest countries on earth to make childbirth safer for mothers and their babies. One of those countries is Uganda, home to Dr. Eve Nakabembe. She is also an obstetrician gynecologist, an international specialist in women's health and advocacy. As a trained obstetrician gynecologist, she's worked in many Ugandan hospitals, witnessing firsthand the challenges of unsafe motherhood, which we'll be talking about. She received specialty training in reproductive health rights at Lund University in Sweden, and she spent 6 months at McMaster right here in Hamilton as part of her obstetrical training. It's a little bit of a foreign concept on this continent that a woman should die in childbirth. It does happen, but not in the kind of numbers we've talked about. And this is World Health Organization 2010 stats. 325,000 mothers and 4 million children every year in the developing world lose their lives. Why does that happen?
In a country like Uganda, which is not, the issues are not very different from any other developing world, there are so many issues which lead to women dying during pregnancy and childbirth. And not all of them literally start from the hospital. You know, you may think, don't they have medications? Don't they have the skilled people? Don't they have hospitals? But it's a wide range of factors, starting from the position of the women and the girl child. You know, you'd be like 14-year-olds becoming mothers. You can imagine a 14-year-old here in Canada, if she has to become a mother, you know, at 14. And then, of course, there are all these issues of the role, gender roles and issues around women and safe motherhood. And sometimes it's issues to do with, you know, transportation. A woman starts labor and she is not even prepared to go to the health facility. She doesn't have the transport, or if the transport is there, just the access, the roads, the infrastructure. And finally, when they get to the hospitals, there are so many issues in the hospitals as well. So you realize that there are a number of cross-cutting issues. We usually call them the 3 delays, that a mother will die because of 3 delays. The delay at home, you know, home itself. There's nothing like call 911 because, you know, the contractions are so strong and you think the baby is coming anytime. So the position of the women when she's at home, is she empowered to know, to understand that this is where I go and this is what these symptoms mean? And that's the first delay, you know, just the delay within the households. And then there's a delay to access facilities, because some of these places are really remote, not only in Uganda, but in many of the developing countries. If you make up your mind to go, it's 2 a.m. You have to get a bicycle. You have to get, you know, somebody to take you. But you can imagine you're in labor and you're at the back of a bike on a very bad, you know, road, really terrible road. Huh? And that's the second delay, you know, in access, transportation. And the third delay is in the health facilities. You're going to the facility assuming that there's a skilled person there, and that skilled person has an enabling environment. The drugs are there, you know, the equipment to help you is there, but most of the times that is not the case. So issues of safe motherhood rotate around so many stakeholders.
Dr. Jean was talking in the green room about a woman about to give birth and there's no water.
That's right. In the health facilities. And yet, you know, when you're in an environment where the resources are limited and every morning you get up and go to the health facility to work as a midwife or doctor and, you know, there's no gloves. I mean, it's just another day in the hospital where there's no gloves and that kind of struggle, and you eventually start to sort of get a little bit, you know, worn down in terms of, yeah, you know, it shouldn't be this way. And I think that's one of the challenges, and really the whole basis of the Save the Mothers program is helping people who are outside of the health profession look into the situation and say, what can we be doing differently in order to improve the health of mothers? I mean, simple things like putting up curtains in the labor and delivery. I mean, here in Canada, I work at St. Joseph's Hospital. We all have our own private rooms. I mean, it's very nice. I mean, women nobody really wants to go to the hospital, but we go there because we know it's going to be a safe, private environment. But you can imagine being in a room where 8 women, where none of us have a curtain, we're just all out there together. So no wonder women don't necessarily really rush to go to the health facilities with that kind of environment. So it's helping people see things could be different. You know, we're not talking about CT scans and really fancy equipment. We're talking about simple things that we can do to make an environment for safe motherhood.
One of the things I remember from a previous visit, and this touches on the cultural barriers, is that some of the husbands were very reluctant to allow their wives to go to the hospital. I can't even remember what that was rooted in.
Yeah. Well, again, in certain cultures, particularly in Yemen, where I worked before, you know, men don't want their wives being looked after by another man in the health facility, and certainly that's true in many developing countries where, regardless of religion, actually sometimes men are very reluctant for other men to look after their wives. So sort of instead of saying, well, gee, my wife is precious enough that it doesn't matter, I just want to get her the help that she needs, it's kind of like, well, no, I mean, she's kind of my property. Like I kind of have to look after her, and I know what's right for her, and it's not right for her to be looked after by another man. So, you know, people again don't necessarily consciously think about what they're doing, that they could actually be contributing to their wife's death or significant disease. So, but it's really about those cultural issues, and that's really what we're trying to do with the Save the Mothers program, is help to educate the public, you know, people through various ways, and men reaching men about safe motherhood, because what affects a family more than a man losing his wife? He's got 6 young children. He's lost his wife. I mean, most of these men, they don't flick on the microwave and heat up their dinner. I mean, they have literally no way of being able to care for themselves in their homes. So the natural thing is to go out and find a new wife. What about those other 6 children? They get farmed out to relatives or whatever, and that man has now exposed himself to HIV/AIDS, all the other issues about going out and finding, you know, another partner. So there's huge, significant impact on the men themselves as well, too, as a result of losing their wives.
I just was reminded this week that when a mother dies, if there is no father present, those children are turfed out of their home in many cultures in Africa. Dr. Eve, you're dealing with more than the grief of loss. It is, it's a huge impact.
It's a huge impact, and like they've said, when you save the mother, you save the best person who is in the best position to look after the family. Because if you're losing a mother who's dying or delivering the 10th child, there are so many issues. First of all, why is she delivering the 10th child, you know? And if she's dying, what's going to happen of these other 9 children? And I always give my example of the so many other issues which easily attract the world's attention without people really critically thinking about the root causes of these problems. Like, you're in the hospital way back at home, and you're seeing this 6-year-old child with TB, you know? And it's been a long process. First of all, you getting her to the hospital, you diagnosing her that he or she has tuberculosis, you starting the medications, all that has, you know, an economic attachment to it. And then finally the child comes and they're like, you know what, doctor, we are sorry. The child is getting resistant tuberculosis because they didn't take their medications. And you're like, why? How? You know, because for you, you're thinking about the cost, the diagnosis, the impact of this child going around the home with more drug-resistant TB. And they tell you, you know, the mother died. Well, you know, she was giving birth, and she's staying with the auntie, and, you know, the auntie has her own other children. Just, it makes you appreciate all the dynamics of save the best person to look after her children, you know. Absolutely. In all these issues of malnutrition, you know, disease, poverty, anger, education, you know, she's the best person to ensure that her kids go to school, that even if it's fetching firewood, making meals, you know, she's the best placed person. But people always can't make that connection, that with the developing world losing so many of its mothers during childbirth, because mothers are delivering, you know, like in their late teens, so you're losing people who are 19, 20, in their 20s, in their early 30s, you know? So it's, first of all, they're still very productive for their population, and they're still in the best kind of position to look after their own families. But in most of our worlds, that connection hasn't been made, that we are getting so many problems, but we're really losing also so many mothers, so many of the best people who can be in the best position to look after their families.